faculty in environmental studies. I study food systems myself, particularly in immigrant community in Manhattan and Chinatown. And so I'm really pleased to be able to be here with you all. One of our panelists, you will see on your screen, is Monica Adams. She's an assistant professor at the Department of Social Work here at Binghamton, who's worked for 25 years in social work and has been doing really interesting research related to the intersection of social justice and food. We also have with us Erin Summerly, who is the director of the Food and Health Network at the Rural Health Network of South Central New York, based in Binghamton. Kate Miller Corcoran began as the farm share manager and is now the director of development and communications at Vines. Vines is a really important organization in our area. In fact, I just took my class for a visit at the urban farm, so I'm really anxious to hear more from Kate. And then we have a group of undergraduate students: Alexandra Miranda, Luz Velasquez, Sarah Vanier, and Francesca Beauvais. And I'm sorry, Francesca Beauvais is a PhD student in the Community Research and Action doctoral program. And these students will share part of a project that they worked on. And I just want to give a shout out to Luz, who's joining us from Spain. She's a Fulbrighter who I worked with. So really happy to have her here as with everyone. So I'm going to turn it over now to you, Monica, to get us started.
Thank you, Valerie. Welcome everyone to the social panel. I'll give you a little bit of background about myself and my research interests. As Valerie mentioned, I'm an assistant professor in the Department of Social Work. Prior to coming into academia, I worked in direct practice as a licensed social worker for about 25 years. And during this time, I was able to really see firsthand how social and environmental factors influence people's health behaviors. As a medical social worker, I work with populations with low income backgrounds. And I work with many families experiencing food insecurity, which really had an impact on me. During this time, I was reminded of an analogy a social work professor shared when I was getting my master's degree. He talked about a waterfall, and oftentimes social workers and other people who work in the community, we're at the bottom of that waterfall. And as people fall over with whatever the presenting issue is, you know, we jump in, we save them. We can't get everyone, but we pull out the people we can and try to keep them from falling back into the water. But he posed the question to the class: at what point do we go to the top of the waterfall to see why people are falling over? And as I continued to do direct practice, I kept having this question as why do so many people have food insecurity? Why is there such health disparity in our country? And that's kind of what led me into the research realm of social work. So my research focus from a food justice perspective is related to health disparities. As I began to continue my work in the field, I began to realize that the emphasis on individuals' behaviors as the root of all our issues is the injustice in and of itself, because it ignores the many social factors that influence our decision making and ultimately our behaviors. So my general research focuses on overweight and obesity from a social environmental perspective. And this includes examining policies that promote and prevent people's ability to make healthy choices, as well as looking at the practices of the food and beverage industry that creates an obesogenic environment that impacts everyone, regardless of their income, background, race, gender, and other identity, in other ways they might identify. My target audience for my research findings includes policymakers, healthcare professionals, social workers, but anyone who's invested in improving the overall health and well-being of populations that have been disempowered with regards to making choices that lead to optimal health and well-being. My hope is that my research will not only lead to people getting connected to resources they need, but that systemic issues that create barriers to open and consistent access to affordable and nutritious foods will also be addressed. Thank you, Valerie.
Thank you, Monica. And it is such a vexing question as to why we have so much food insecurity in our country and around the nation. I mean, around the world, I might add, especially in light of the fact that this is not an agricultural productivity issue. It's an access and distribution issue. So next we're going to move to Erin Summerly.
Well, thank you, and welcome everyone. And thank you, Monica, for setting that up so beautifully. You sort of laid the groundwork for, a lot of the reason behind what myself and my organization do what we do. So I won't repeat a lot of that, but just for a little bit more context, my organization, as you heard in the introduction, is the Rural Health Network of South Central New York. We're based in Binghamton, but we cover a multi-county region. And I'm the director. Of course, my dog starts barking. I hope you guys didn't hear that. I'm the director of our Food and Health Network program. So the organization as a whole, our mission is really to improve the health and well-being of rural people and communities. And again, not just looking at health narrowly as, an individual's sort of clinical health outcomes or just at an individual level, but recognizing that we as individuals, obviously are impacted by a whole wide range of, social environmental policy factors, as Monica talked about, and we can't have healthy individuals without looking at community development, economic development. And so our organization, runs a wide range of programs that are both about healthcare access, but also removing and addressing a lot of barriers related to transportation, health literacy, and then food, which is where our Food and Health Network program comes in. So we really try to look at different types of programs and policies that are sort of at that intersection, both of food access, but also health and healthcare, and then local food systems. So bringing in agriculture and local food businesses. So that's sort of where we focus our work. And I guess I'll just give a few sort of key overviews of some of our programs. And one of our big areas of work and sort of that fits really nicely within sort of that intersection I just mentioned is our work around farm to school. So, I'm sure most of you are aware, many students really, regardless of income level, eat a significant amount of their meals and get a significant amount of nutrition through school meal programs. And with our work with Farm to School, we coordinate farm to school programs in 26 school districts in 5 counties. And we, through a program called New York Thursdays, help schools develop new recipes that highlight seasonal and local produce and get those on the menus several times a month. Last year, just 15 out of those 26 school districts spent over $1.5 million on food from local farms. So it's really, it's not just about getting, students access to better food, but it's having a very significant economic impact as well. And then we work closely with a lot of community partners to provide additional education. And obviously it doesn't do any good if it's on the menu and kids don't want to eat it and aren't familiar with it. So, that's another part of the programs that we need to sort of build up. Another big program that we work on is in this space of food as medicine, and not the idea of, telling people what they, should or shouldn't be eating, but that food access and nutrition should be a more central and integrated into actual healthcare delivery, and not sort of an afterthought, but something that's more central to prevention and treatment of chronic health conditions. And so we run a fruit and vegetable prescription program, and that allows healthcare providers and non-clinical providers like community health workers to prescribe produce to patients who are food insecure and have or at risk of sort of diet affected or sensitive chronic health conditions. And so sort of like with that in the waterfall metaphor, you know, we have a lot of registered dietitians or other providers who have spent years saying, you know, you need to eat, you know, X, Y, and Z for your health, but have no sort of actionable sort of resource or tangible resource to give individuals. And so, you know, individuals who are eager, you know, to make those sort of changes or, you know, purchase what they want to. So we provide financial resources and then folks are able to, you know, buy the food that they otherwise would have some barriers to accessing. So people can shop at farmers markets with the Vines Farm Share program, a whole bunch of local grocery stores. We try to make it as broad as possible to fit into people's schedules and lives and preferences, and also offer transportation support with that. And just I guess last piece that I'll add on programming from an access standpoint is, I think, you know, many people are probably aware or not, depending on the area in which you live. But I think folks might be more familiar with issues around food deserts or, you know, various terms for lack of access to food retail in more urban areas. But there's also a huge disinvestment in rural areas as well. And so we're doing some work on research on rural food retail and how we can help sort of build back that capacity as well in this region. And I know one of our prompts was sort of how people can get involved. And I would just say, you know, I think in this space around food, there are so many advocacy opportunities. So I guess in terms of a call to action, that's what I would sort of leave people with. If you're in Broome County, there's the Broome Food Council, which is a food policy council sort of type or working towards getting to that. And there's just a lot of advocacy opportunities for policy change that I would be happy to chat more about in discussion. So with that, I'll hand it over.
Thank you so much, Erin. Yeah, there are many things that you said that I hope we can follow up on. It's so good to hear about more of what your organization does and kind of the dots that you're connecting. So next, let's move to Kate to tell us about Vines.
Hi, thank you so much. Well, for anyone that's not familiar, Vines is local to Binghamton and Broome County. We started in 2007 as a volunteer-led organization. We now have a total of 7 people that work for us. So we haven't expanded in the staffing very much, but we've expanded a lot in our services. And the reason that, I shouldn't say services, but our programs, that is the reason that we can expand so broadly is because we have so much community participation, and we have so many volunteers. We have thousands of hours of volunteers hours that come every year to Vines. We are committed to developing a sustainable and just community food system. We do that through our 6 different programs, and because there are 6, I'm going to zip through them quickly and give you some highlights, and if you have questions later, I can answer them. You know, when we started in 2007, we started with 2 community gardens. We've now expanded to 21 community gardens in the past 15 years. So we're really proud of that. All through the greater Binghamton area, we have over 400 raised beds that community members have access to. And those beds, when people rent them, they have soil, people have access to seeds, seedlings, water, tools, and their site coordinators who again are volunteers and are a wealth of knowledge. Those are very much community led. When people want to start new community gardens, we now have a proposal process that really empowers community leaders to do the work of doing the outreach, talking to people in the community, making sure there's community buy-in so that we're not just plopping community gardens where we think they should go, but where people really want to be participating. We also know that not everybody can make it to a community garden. Though we have 21, there are 200,000 people in Broome County. So we recently launched our Build a Garden program, which is for people that are just too far away or have transportation barriers or access barriers in other ways. So we'll go to their yards and build garden beds, or for folks that don't have yards or possibly live on one of the many hills in Broome County, we have garden bags that people can put on their porches or their stoops and grow their vegetables. And again, those come with fertile soil and seedlings and education. One of our favorite programs is our Grow Binghamton Youth Program. That's been running since 2010, which is when our urban farm also started. Now it is a year-round employment program. It was just 6 weeks in the summer, but now we have 8 weeks both in the spring and fall. During that time, the spring and fall, our youth are building those gardens and meeting those community members, which is a really awesome experience. In the summer, they're at the urban farm growing food for the community. And they also are, we take them out to some rural farms, blueberry farms, and up to some cool alpaca farms, just to see all different kinds of farming. But we know not everybody's going to go into farming. That's part of our program. So we make sure that there's other life skills that are discussed during this time. Actually, when I went to go talk to the youth this year, they said, "Are you here to talk to us about money also?" Because we do a lot of financial literacy, a lot of talking about not just how important credit is, but how to build your credit. How do you actually do those things? How do you go to a bank and open a credit or a checking account? You know, those are basic skills that our youth need to know. So we absolutely love our youth. We've had over 100 youth come through our program. All the food that is grown at the urban farm, which is 2.25 acres in downtown Binghamton, please come visit us anytime. All of our food is distributed through Farm Share, which is an all access CSA. Erin talked a little bit about it. We participate with the fruit and veggie prescription program. We also have discounts for this. So people come every week to the same location in their community. It's usually in a food desert or very close to a food desert. And it's staffed by volunteers who, again, are very knowledgeable about the food that's coming, so they can speak to it and give people great ideas on how to use that produce that they're receiving. It's flexible. There's different sizes that folks can get. There's different discount levels. People can pay with their SNAP benefits. So we really try to continue to make it that accessible. But like we've talked about, I think the thing that pulls this all together is our Green Thumb education workshops. And those are free to the community. They are now hybrid. Thank you. One of the rainbows of COVID is that we really learned how to make things hybrid and more accessible to everyone. And we go through everything from gardening 101. So those folks that are first-time gardeners can learn how to, you know, make their gardens the way they want them to be and have success in growing, to composting, and then of course cooking the food that they're receiving or growing and preserving it, because really being able to grow that food and can it or freeze it helps prolong the growing season for people and prolong that access. So that is Vines in a nutshell. I don't want to continue to go on because I could forever. So thank you so much. And I look forward to answering questions.
Thank you, Kate. It's just so wonderful to hear how Vines is, using gardening and kind of, household level and community level food production as a way to build other skills and to empower youth and to bring people together. So next, I'd like to introduce our group, and and of the 4 group members in the next, feel free to each one of you, join in as you feel fit. But I'll introduce you all together. So we have Francesca and Sarah and Luz and Alexandra.
Okay, great. I can share my screen. Okay.
Perfect. Thank you, Sarah. So hi, everybody. Today, our research team is going to tell you about our recent project that we did together and the article we wrote about it together, which is titled, "It Felt Like My Son Had Died, Zero Tolerance and the Trauma of Family Separation." The primary investigator of this project is Dr. Oscar Gil Garcia, who is an assistant professor in the Human Development Department here at Binghamton University. And this year, he's at the University of Buffalo as a distinguished visiting scholar through their Center for Diversity and Innovation. And as Valerie shared, all four of us presenting today are either current students or recent graduates of Binghamton University. And Sarah, you can go to the next slide. So our work follows the story of a boy named David, who Sarah will be telling us more about after this. And just as a note, as we get started, all of the names we're using today are pseudonyms for the protection of the individuals that we worked with. But for some background, Dr. Gill met David and his family in La Gloria, Mexico, when he was doing work there with displaced indigenous Mayan refugees who were forced to flee Guatemala following the civil war that took place. Dr. Gill has been working with indigenous Mayan refugees in La Gloria since 2004, when he began doing ethnographic work there. He, along with his brother, Manuel Gill, who is also a professional photographer, continue to share a photo documentary project about the individuals they met in La Gloria. And there's actually currently a photo exhibit of their work up in the Robertson Museum here in downtown Binghamton, if you're in the area and you'd like to go check that out. The first photo you see on the top here is of an official naturalization ceremony. So Dr. Gill was able to petition for citizenship in Mexico for many of the refugees he met in La Gloria. And this photo kind of captures that amazing accomplishment. And the second photo on the bottom is of one of the many families that Dr. Gill and Manuel Gill met in La Gloria. And this is one of the many photos that was taken by Manuel. And you can go ahead and flip, Sarah. Oh, unmute. Sarah, you have to unmute yourself.
Oh, sorry. Okay, so I'll start with David's story a little bit. David is a US citizen of Acatec or Maya origin from a mixed status family. So that means that his parents are not citizens of the US. David has experienced family separation twice in his young life. The first instance occurred in 2007 when David was 4 years old. Immigration forces were increasing across the country, and David's parents feared that they would be deported and separated from their infant son, David. So to avoid involuntary separation, Evelyn returned with David to Chiapas, Mexico, and Carlos stayed in the US to work and send remittances home. This is what we call a de facto deportation. Fortunately, the three were able to reunite in Mexico 2 years later. And then David's second experience of family separation occurred in 2017. So he is a US citizen because he was born in the US, and he eventually expressed interest in going to the US to get an education there. And his father, Carlos, agreed to accompany him across the border. David was a minor at the time, and Carlos thought that he would be permitted to enter the US as the guardian of his citizen son. So unfortunately, under the Trump administration's zero tolerance policy, immigration officials detained Carlos, where he remained for about 2 months. He had no ability to contact his family. His family was not informed of his whereabouts. And during that time, he had not been informed about where his son ended up. So during that time, reflecting on that time, he remarked, "It felt like my son had died." And David was placed in the foster care system. The foster care system is not designed to deal with the unique challenges of people who have experienced family separation, such as David. He felt isolated due to his language differences. He did not speak English at the time that he first entered the foster home, and nobody in the foster home spoke either Spanish or his indigenous language. He also had unreliable access to a phone, which was his lifeline for calling his family. And he began to experience symptoms of trauma and depression, such as insomnia and lack of appetite. And in our article, we reference the Physicians for Human Rights study on the psychological effect of family separation for asylum seekers as a framework to examine David's experience. And we found that many of his symptoms lined up with the ones of the participants of the PHR study, such as trouble sleeping, eating, grappling with isolation and despair. So now I will pass it over.
So we learned David's story and his experiences through a series of interviews over time, throughout about a year. After reviewing our interview data, we were surprised to not only learn about the adverse life experiences he faced due to the implications of the zero tolerance policy, but also very clear signs of serious mental health struggles following being separated from his family at a young age. It was during this process of interpretation that we changed our focus and we decided to frame our work more about the severe trauma that David and other children in the same circumstances as David experienced due to family separation, because this is not what we were expecting to find when we were reviewing our data, but it was impossible to ignore. And the article we wrote was published this past May in Latino Studies. And you can switch sides.
So for the implications of the research, so as has been expressed, this article explores the hurdles that deportees and US citizens, especially those of Indigenous descent, who join their parents abroad and the difficulties, they face upon return. So one of the interesting components of our article is that it focused specifically on the perspective of a US citizen. And oftentimes research tends to focus more so on the immigrants and not these complex mixed status dynamics that occur very traditionally here in the United States, where there's often children who are US citizens with parents who are from countries outside of the United States. So we utilize David's story to illustrate the harm that is caused by our US government and specifically their deterrence policies that are created to prolong these effects of trauma that is very much seen within our article. These deterrence policies, such as the zero tolerance policy, thankfully is no longer in effect. However, there are still thousands of examples that we can demonstrate where the United States has utilized deterrence policies that have affected communities throughout history. And we argue that these deterrence policies normalize the systemic neglect that US citizen minors who are placed in foster care, and how this creates barriers to not only their mental health, but access to also health and education services, and prolong this trauma of family separation. So not only are we shedding light on the mental health issue, but also demonstrating how there are additional barriers, because mental health is something that impacts humans in all aspects and dimensions of their life. And so we see this becoming an issue once he's attending school in the education system, and also due to the limited access to health services, this mental health impact is only further exacerbated and creating more long-term and prolonged trauma.
Yeah, so exactly how Luce mentioned, like the main issue that we've been like discussing throughout our research definitely has large scale implications for not only people like David, but people who may be undocumented, who may have DACA, and looking at those mixed status families and how this demonstrates how though like the zero tolerance policy has ended, the immigration system overall works to separate children from their families and further traumatize all of those involved. So radical changes must be made to the immigration system to provide a clear, accessible path to citizenship instead of threats of deportation and familial separation. So our work builds upon prior scholarship that calls for a deeper investigation of the relationship between the immigration system, the foster care system, and the carceral system, and how these all intersect to perpetuate lifelong trauma and mental harm. And to bring this more to a focus on David's case and also other people who the same age as him may be experiencing similar issues, David is currently in high school and plans to pursue a college education. So how could a college campus like Binghamton University be prepared to support a student like David or other similarly situated students, either mixed status, undocumented, or with DACA? So how can a university like Binghamton adopt policies that emulate sanctuary campuses or sanctuary cities that have practices in place that are meant to support undocumented students and community members? So we must ensure that equity and access by providing opportunities to support students like David at Binghamton and beyond.
Thank you so much. That was a really in-depth account of one particular story, which I'm sure we all know is represented much more widely than this one particular case, and that you had the chance to get to know David and his hardships in this way is really illuminating, and I think helps us kind of maybe draw some through lines between some of the issues that our panelists raised in terms of challenges in rural health, equitable food access and food security and food sovereignty, right? The empowerment of individuals and households to provide for themselves, and where that might intersect with individuals' identities, their sense of belonging, and their background, whether their legal status in the country, or their cultural background from wherever they come from, nationally or internationally. And so to focus our discussion as a next step, and please, anyone in the audience, put a comment in the chat, or if you'd like to, unmute yourself and chime in, you can also do so. But to get our discussion started, I thought we might start, since this conference is really focused on action and a call to action, like you mentioned, Erin, and volunteerism. And what I like to think broadly of is sort of the care economy, and work that's really driven by compassion and the motivation for community empowerment and public good. Maybe you can all share some of your successes, maybe some of your wins, a hardship or a challenge that you identified in your work, in your research, in your relationships with people around these issues, where you've seen a positive change with one of the social or environmental constraints that we recognize as being problematic for populations at large.
I can comment on that a little bit. I don't necessarily have a concrete example of the positive change, but me being the hopeful person I am, I'm hoping this will lead to it. I did some research on food insecurity among low-income women, but I did it from a strength perspective. A lot of times we talk about food insecurity and how it impacts health, et cetera. It's kind of deficit focused with regards to what's missing from that environment, or when we look at overweight and obesity, and we tend to compare the marginalized population to the non-marginalized population in the context of what the marginalized population is not doing. So I wanted to look at it through a strength perspective, meaning that though low-income women are exposed to food insecurity in these obesogenic environments through food deserts and food swamps, most women with low income do not have an obese weight status, which led me to believe there are some protective factors in their social environment that they're drawing on to prevent their weight from going up. So I'm hopeful that the findings from this research can lead us to developing some strength-based perspectives that build off of the protective factors that are already in the community versus, oh, it's food insecurity, let's get them some food and it's fixed. So hopefully that's something, like I said, that can lead to some positive change.
If I can tell a story, we have some wonderful volunteers, of course, as I've said, through our many programs at Vines, but I think something, just building off what Monica is saying, we have some wonderful volunteers that become that are part of the program, and then they find ways to empower and find what they're interested in and what their skill set is, and really apply that to the work that we're doing. So we have volunteers that will come in and they're really great at cooking. And so they start to do cooking classes, and they feel empowered because they are the ones delivering those classes. It's not people from outside of their community. It's really, you know, doing that work inside of the community. And I think when we see these things, those are the success stories that I really enjoy seeing throughout all of the Vines programming, and throughout all of, you know, with Erin, I know there's some folks through the fruit and veggie prescription program, just because we're so intertwined with Farm Share, and, you know, like I did that for 5 years, but people who are really seeing positive results, not just in their health, but in their, you know, their social communities, their social health, their social isolation starts to decrease, and they're finding ways to connect. So that is a definite success story for us.
I think for us, when Dr. Gil Garcia was doing his original research in Mexico, he was actually very focused on giving back to the community, and managed to get some of the indigenous Maya there citizenship, which allowed them access to social services and many rights they wouldn't have had otherwise.
Thank you. Go ahead, Erin.
Okay, I can share one additional one. I mean, I would certainly echo some of what Kate shared, just in terms of impacts with some of our fruit and vegetable prescription program work. But I also realize, you know, any type of nutrition incentive or sort of food access programming, again, to this point, is sort of a Band-Aid, you know, and it's temporary unless the larger conditions, you know, resulting in that circumstance are addressed, which we can't always do just by, you know, giving someone $360 to spend on produce, not to minimize the impacts that those programs have at all, because they are real, you know, and they're impactful. But yeah, I would just echo some of what Kate had spoken about, in addition to maybe some of those more temporary changes, people's just overall confidence and engagement with their healthcare providers, and overall sense of well-being, and again, yeah, just confidence and sort of empowerment in terms of feeling some more control in general. I think that those factors last, you know, a little bit longer, even beyond the period, and we can offer that incentive. But at more of a systems change level, I guess one win is that there's been so much policy, both at the state level and federal level, of you know, in a shift, I think, in support of this type of programming, understanding, especially as we've seen the impacts that the increase in the SNAP allotments had during COVID on poverty rates and things like that. And then just a lot of legislation in support of you know, Medicare and Medicaid paying for, you know, nutrition and food access programs. And not that it's totally there yet, but I think there is, you know, there's a lot of positive movement in that direction. And even in New York State, there's a campaign right now in support of, just within the New York budget, universal free school meals, you know, for all students. And so I think there's just a lot of still a lot of issues, but, you know, I think that there is some positive movement in that direction of some larger changes.
That's really fantastic to know. I know I've seen, you know, since I have school age children, so being aware of what's happening in the school lunch program has been really inspiring. Although I think the quality of school lunch is another issue. And that was a perfect lead in, Erin, to where I was thinking of taking this discussion next, because so one of the through lines between all of your work is advocacy, is thinking about food justice, immigration rights, and equity in this space is not an individual problem that's about behavior change and choices amongst individuals, but is rather about the collective kind of infrastructure and political system and social systems that are set up and become either constraints or opportunities for people. And so, so with that in mind, and again, with the theme of the conference and the call to action, where do you see there being kind of opportunity for advocacy and volunteerism, maybe specifically, and which policies do you feel strongly about working to bring light to or to push forward?
Yeah, I can start from the lens of our topic. So even though the zero tolerance policy that kind of inspired starting this work has since come to an end because of the change of administration from the Trump administration to the Biden administration, that doesn't mean that family separation isn't happening anymore. And what it also doesn't mean is that the children who were separated from their families have since been reunited with them, especially due to the pandemic and the limited access to travel across borders. So we wrote this article when zero tolerance was still in effect and it was having a very large role on people's lives. But even though it's over now, a policy ending doesn't necessarily mean the implications of that policy ended with it and the struggles that came from it ended with it. So our work, even though in the end of our article is a call to action to end zero tolerance policy, and even though we've achieved that, we can't be done because family separation is still happening. Trauma of children who've been separated from their parents is still happening. So we continue to advocate for these people and these populations and for mixed status families, because regardless of the change of administration, and in this case, regardless of the change of a policy change, we're still seeing the same struggles happen, and it needs to be a larger systematic overhaul. So I guess we can kind of start with that. I don't know if anyone else wants to add.
Yeah, I could add something about that, Francesca. That was like perfectly said. Like that's definitely like very true that there are still people like who have not been reunited with their families, even though the zero tolerance policy has been ended. And if we want to bring it back to like the immigration, the focus of immigration rights in relation to the Binghamton community itself, talking about how there is a lot of power when you see community relationships and ties between the students on campus at Binghamton University and community members, and kind of looking for a relationship where there can be more overall support for immigration rights, and that we can see structural and policy changes at Binghamton University where there's actually infrastructure in place to support students who come from mixed status families or undocumented themselves, instead of building a culture of isolation, which furthers a whole set of issues, whether it's related to income, access to getting books for class, how to pay for college, how to like stay enrolled, the mental health implications of it, and also the general fear of deportation and separation. And kind of bringing us back to like the students and also community members and any faculty and staff involved about how this is everybody's issue. This isn't just one person's story. Unfortunately, David's story is not unique, and a lot of people have undergone familial separation and deportation, and looking at how this is something that we all have to advocate for, or we're going to see the same issues consistently. And that when we're providing care for undocumented populations and people from mixed status families, that the care is on a holistic level and not just on the focus of building towards citizenship, even though that would obviously be ideal, but understanding that this is a broad-based issue that intersects with so many different systems. So yeah, just bringing that back to what our community can do.
If I can build off of what you're saying, Alexandra, I'm thinking about on this on the smaller scale that Vines is really focusing into the community, thinking about cultures of isolation and having a sense of belonging. I think the next steps for Vines, now that we really are starting to have these great community gardens, we need to start thinking about culturally appropriate foods, having those in our CSAs, having a better understanding of how to grow some of those foods in this climate, because that can sometimes be a barrier in itself, is the climate that we're growing food in. But I really see that as kind of, when you're talking about the holistic view, is having those culturally appropriate foods available.
Thank you. Thank you for that, sort of some really great specific examples. And I wonder, Erin, you kind of, one of your last comments in your introduction was about the Broome Food Council, and you said there's other kinds of examples. I wonder if you might, elaborate on those specific examples a little bit more to inform people.
Sure. So yeah, specific, I guess if you're based in Binghamton or Broome County, there is a group. It's been around for a while, but it started off with a bit of a narrower focus. It was called the Broome, oh gosh, maybe Kate, you remember Broome County Child's Hunger Task Force or something like that. It was pretty like narrowly focused on issues around child hunger, and brought together sort of a collaborative effort, sort of chaired by a number of different organizations like the Health Department and Food Bank and Broome Tagabosis and all sorts of different organizations who participated though. And over time, it's been working to move a bit more towards a food policy council model, which ideally, has a broader scope in terms of the type of issues, is more focused on advocacy, and looking at, some more root cause. I mean, obviously, trying to increase participation, in SNAP and, other available benefits still like very important, but looking a bit more broadly at some more of those root cause issues. And, we need to involve discussions, right, on housing and transportation and, poverty and other things as well, structural racism, like all, it needs to all be part of the conversation. And then also, I think ideally is having more community representation within it. It started off very much as a lot of organizational partners, and I think over time, hopefully with more involvement and community representation, will move more towards that true food policy council model. But for folks based elsewhere in New York State or nationally or wherever, there's a sort of growing number of food policy councils. And there's a list through Johns Hopkins that has a whole bunch of those active food policy councils across the state. I don't know if you want to add anything else to that, Kate. I know you've been involved.
I mean, policy-wise, yes, you've nailed it. I think that going into the community and finding ways that you can use the skill sets that you have in whatever capacity you can is a great way to get involved.
Thank you. So I see from the comments that are in the chat, and this resonates, I think, what you were talking about, Kate, in culturally specific foods, and I think relates to just your comments, both you and Erin right now, about representation in general and who's involved, right, and who can access these groups or maybe has the time to volunteer and spend in ways to kind of express what needs of different groups are, through culturally appropriate foods. I mean, I think that's such a powerful sort of, food is such a symbolic representation of heritage and culture. And we certainly see through major retail. I mean, at our major supermarkets, that there's more emphasis on that. I don't, think it's fully enough, but I also see just in our own community more small ethnic-based grocers, and I find that really encouraging. I personally, it's my interest area too. So I'm connecting this with Cynthia's comment about wanting to do a heritage garden, making through lines and food as a way to foster belonging and social awareness. So those are all really positive things. I do see we have some folks there's someone from Michigan University Food Pantry here. I wonder if there are other people from different communities who might have other examples to bring to bear on our conversation. So if there are, please chime in about other examples of projects that can be done. And I wonder, I want to take a little bit of time to shift the focus, since we all, there's such a, inspiring group of women here. And I know that this kind of work, when you're focused on helping others, I wonder where personal kind of motivations come from, and how you kind of maintain, positivity and endurance in doing this kind of work.
I can speak to that. I think my motivation just comes from my career as a social worker and trying to empower people. And kind of piggybacking off of your last question about where do we go at as far as advocacy and what are our next steps. Women are more likely than men to have food insecurity. Women are more likely than men to have minimum wage jobs. Or even if you have the same job that pays a little more, you're probably going to make less. So with that being said, in addition to what we're already doing, I think our next steps for advocacy are advocating not only for people to get access to food, but access to the resources to purchase the food. I think it's the disservice to primarily focus on getting people the materials versus empowering people to go out and get their own. And that means we have food stamp allotments that actually mirror the actual cost of food. And I know SNAP is supplemental, but think about what we're supplementing. We're supplementing a $7.25 an hour minimum wage. So it's like there's a disconnect there. So advocating for improvements for increased minimum wage, advocating for getting away from the two different minimum wages. If you are somebody who relies on tips versus someone who gets a straight minimum wage, these changes would be so impactful for women in general. So that's kind of where my motivation comes from, empowering people to be self-sufficient. And that means getting policies in place that create equality in pay and access to resources, not just access to food.
I'd love to chime in as well. For me, motivation definitely comes from a personal connection. I experienced family separation, and it's not an easy thing to endure. And I think additionally from that is just from constantly having the history of my people be erased and not feeling supported in the spaces I enter with the identities I have. So something I really wanted to shed light on is the importance of just hearing people and having people feel like they belong in this country, especially our immigrant population. And in Binghamton, there's a large refugee population, if you weren't aware. And just a simple act of acknowledging them, understanding there might be a language barrier and being patient with them, offering your language skills and abilities if you can, taking the time to volunteer and help someone at the grocery store who's struggling. It's really the small things you can do that help people feel like they belong and that they're not wanted in this country. We've experienced so many years of just this negative mindset towards our immigrant population, and that's still felt very, very prevalently in our country. And I think it's just a simple thing of saying hi and acknowledging a person and validating them and lending an ear and validating their experience and feelings and asking how you can assist them, whether that's welcoming one into your home and offering them dinner. And, there's just so much I've worked in Binghamton at the American Civic Association, worked with a lot of immigrant populations, and just the inability to access resources due to transportation and issues or income barriers. It's just very sad. So just being willing to hear stories and also challenge what you hear every day in the news and really get to know the people who are impacted by these policies. I think oftentimes we think about policy and policy at all. And like, who are the people that this policy is impacting? Where is this policy playing out? Do people in government understand the way these policies are happening on the ground? Most likely they do not. So let them know if it's working and speak up when they're not. And I think that's something you can do that's really powerful, because together with our voices united, we're so much more powerful. So I think that's something we can do as a community, is stand up together when we see injustice and not stay quiet and stand by it.
Can I chime in again? You said something that really resonated with me. Because I feel like you're saying something that I say. We really need to address the stigma associated with poverty, associated with being an immigrant. And really, that comes from changing the narrative. And I'm going to use the example you just gave about people, the language barrier. So the current narrative is you need to speak English. If you're in a country, you need to speak English. I can't understand what you're saying. Changing the narrative means, yes, they may not speak English as well as you, but they are speaking some English as their second language, which means they're bilingual. Most Americans are not bilingual, so actually they are ahead of us with regards to that. And that's just an example of changing that narrative. Instead of saying, oh, well, yeah, we need to improve their English. Well, no, maybe you need to learn a different language so that you can be bilingual too. And just, it's so important that when we engage in these conversations, that we start to change the narrative and change public opinion, because public opinion also impacts policy changes. So thank you for bringing that up.
I think actually related, if I could just add one more thing related to what Monica was discussing with like changing the narrative, addressing stigma. I think a really important way like to do that is to actively confront and challenge our own implicit biases that we may have towards other marginalized groups, especially since we're focusing on immigrant populations, understanding like the privileges that come with being a US citizen, if you are a US citizen. And I've experienced deportation in my family in the past, and being confronted directly with how much can be lost like so quickly, and how citizenship, like being like born in the US comes with so much privilege, and acknowledging that every single day, and like acknowledging the mobility that you have and the freedom that you have and the rights that you have, and utilizing that privilege and that knowledge to confront any biases that you may have towards immigrant populations, and how that may be rooted in xenophobia and racism, and utilizing your privilege and your platform to support immigrant populations and the people in your life and in your interpersonal relationships and the community around you. Because like I said before, like a lot can be done. And like we've all been saying, like a lot can be done when there's a lot of people involved and when entire communities are involved. Because this is something that even if you're not impacted by it directly or haven't experienced deportation in your life, somebody else has experienced it, and that matters. And like that person should not be, and their story should not be hidden and buried away, because there tends to be a culture of silence when we're talking about immigration, citizenship, and privilege. But it has to be brought into the limelight and confronted and challenged and questioned in order for those stories to be brought to like the main like place in our society, and for changes to be made for those populations.
Thank you so much, Alexandra, Luz, Sarah, Monica, Kate, Francesca, and Erin for giving so much of yourselves today and for these inspiring words. It's, I feel it's inspiring to hear from all of you at all your different levels of career and engagement in this. And so thanks again. This was a really wonderful panel. Thanks to all the attendees who came. And we're going to wrap it up.
Thank you, Valerie.
Thank you.